Hey everybody, Dr. Greg Barston here, and this presentation is on ultimately our ultimate treasure, our brain health, something that's not necessarily recognized as prominent or as important as we think it should be. And so what we're going to be talking about here in this presentation is some very simple anatomical and important information regarding the brain, as well as some nutritional support and things that we can do to kind of optimize the health and longevity of this vitally important tissue and structure. Just know that this information has not been evaluated by the FDA. It's not intended to diagnose, treat, cure, or prevent any disease. So we're talking about a brain health outline for starters. We'll talk about some basics and requirements, as well as statistics of brain, what the brain needs, dysfunction categories, some things that help destroy the brain, and it's also a really interesting topic about the gut and how that connects with the brain and how those things are related to each other. Also the brain barrier and brain drains, we call them. The impact of gluten on brain cells for many people. Sugar and insulin being a possible brain enemy number one. Again, kind of finishing up a little bit more about the intestine and how that kind of ties in our gut with the brain. Brain molecules, we'll do a couple of image and verbal memory tests here on the presentation. And then we'll finish up talking about some diet and brain health, some targeted nutrients, and some solutions for you. So some basics of the brain. We've got a bunch of different lobes in our brain, and there's the first one's called the frontal lobe. That gives us information about impulse control, motivation, emotional drive, or motivational factors and things like that. Fine motor control, like small handwriting, things like that. Temporal lobe is in the middle part just above our ear, and that's related to hearing and sound as well as memory, our direction and orientation, something called our circadian rhythm, which is various hormones like cortisol and melatonin. Those are things that fluctuate from the day and the evening. And then also speech and smells. The parietal lobe is kind of on the top part of the brain in the center there, and that's where we perceive sensations and depth perception as well as balance. The occipital lobe is in the back of the brain, the back of the head there, and that's related with vision as well as determining shapes and colors. And then finally the cerebellum, which is a little cauliflower kind of part of the brain. It's at the base of the brain, just above the neck there. And that has to do with muscle coordination and inner ear functions. A lot of times we'll find people with vertigo have problems not only just with the inner ear, but also parts in the brain, and specifically the cerebellum. So some other brain basics. Know that half the weight of the brain actually are what we call glial cells. And there's a variety of types of glial cells in through there called astrocytes and oligodendrocytes and things like that. But that's the immune system actually of the brain. So believe it or not, the glial cells outnumber our neurons, or those little nerve fibers in the brain, 10 to 1. Problem is the glial cells, as great as they are, they're very easily damaged by low oxygen, by dietary problems, by toxins like heavy metals, pathogens that are maybe living with us. Trauma can also do this too. This is why concussions can kind of damage glial cells. Now, an interesting statistic, note that only about 3% of our body weight is from the brain, but it requires over 25% of all of our oxygen that we take in. So it's kind of an oxygen pig. It really needs that dough to function properly. So it tells you the level of importance that the brain has. Some other basic brain requirements: it needs stimulation. It's the old, you have to use it or lose it. It also needs fuel in the form of glucose, and it needs oxygen. And oxygen is what gives us the energy for the brain. Some interesting statistics: as we age, we become increasingly vulnerable for dementia. And this can mean memory loss, impaired judgment, bad language skills, or everyday skills like managing a bank account, and even simple motor tasks like driving. The greatest nerve density or population, though, of those nerve fibers occurs at 17 weeks of gestation, so even before we're born. So an interesting statistic there. Note that memory and cognitive decline start before age 50, and by the time that we're about age 80, it's estimated that nearly half of all the people will have some form and some degree of dementia. And there's an interesting article that talks about this in the journal Age. Alzheimer's disease, which we abbreviate AD, is actually the 6th leading cause of death in the United States. And interestingly enough, in 2013, there's over $200 billion has been spent in the United States alone on Alzheimer's disease. And it's purported that there will be, by the year 2050, the cost for Alzheimer's disease and Alzheimer's disease related problems is going to go over $1 trillion. So very interesting. Note that 1 in 3 seniors, this is age 65 or over, dies with Alzheimer's disease, some degree of it, or some form of dementia. Within 20 years, 1 in 4 people over 50 will have some form of Alzheimer's, And there's also an estimate that there's going to be a 40% increase in Alzheimer's disease in ages 65 and over in just 11 years. For more information, you can go to the website alz.org. A lot of great scientific evidence about this. It's also been published in many peer-reviewed neurological and medical journals, but I'm trying to keep this pretty simple. Now remember that half the weight of the brain are these immune cells called glial cells, and we got a lot more glial cells in every neuron, and the glial cells are very susceptible to inflammation, so we really want to protect them because that's what takes out our brain function. So most common sources of inflammation can include bad fats. We talk about trans fats and fried foods and things like that, but also toxins, low-level infection. Chronic, I put EMF/RF. That's electromagnetic field and radio frequency field exposures. These are things like from Wi-Fi's, routers, cell phones, near cell phone tower stations, things like that. Obesity, because obesity creates a lot more inflammation in our cells, especially if it's around the midriff and in our waist area. That's more than just an extra bag of calories around there. Those fat cells around our midline actually create more inflammation producing molecules than in any other part of the body. Stress, excessive carbs and sugar, or what we'll just call sugar imbalance, lack of quality sleep, a lot of prescription medicines, food allergies, nutritional imbalances, and again we talked about head trauma. And all of these things speed neurological degeneration, so we lose brain endurance, and the first things that we sometimes will notice is we've got low reading retention. We can't remember what we keep reading, or a lower ability to learn new information. So a key concept here is that brain inflammation in any of these shapes or forms speeds neurological degeneration and cell death in the brain, and that then also produces an endocrine control center problem. This is the areas of the brain that control our hormones. So a lot of hormone problems, believe it or not, come from the brain. Yes, the glands might be involved, but we tend to think more peripherally in conventional medicine and even in natural medicine. Really what we should start orienting our index of suspicion is a lot of times focusing up in the brain, which is where it all starts. So again, this inflammation thing, which I'll be talking about a lot, contributes to a lot of brain inflammation, and this can also be included by gut or even systemic pathogens like infections. And it's mostly an insidious problem, though. So a lot of people have this brain inflammation. In fact, most of us do to some degree, and we just don't know that we have it. We can't feel it. We can't see it. The first symptoms are largely ignored until it's in the later stages. So once a brain neuron or a glial cell is significantly inflamed, it's difficult to really kind of put the fire out. And as they say, you can't unhard boil an egg once it's cooked. That's a famous quote from a colleague of mine who's a brilliant clinician, Dr. Tatis Karazian, whose great book, Why Do I Have Thyroid Symptoms When My Lab Tests Are Normal? You can find that any place on Amazon or major bookstores. It's a really nice saying in through there, and it's true. So addressing brain inflammation is really a key to proper management of all brain disorders. So some major types of dementia. These are all different types of dementia. Alzheimer's makes up most of it, about 70 to 80%. There's also vascular dementia. This occurs when there's a stroke problem or silent infarcts in the brain. We call it, it's like a little mini heart attack in the brain. Parkinson's disease, there's B12 and hypothyroid-induced types of dementia. There's an autoimmune form of dementia when the body starts attacking its own brain cells in through there. The classic version of that would be MS. Alcohol and drug abuse forms of dementia, and there's also other forms of hormone deficiency dementia. So MS, as we talked about, it's an autoimmune condition in the brain and the nervous system, and any autoimmune condition, not just MS, starts off, as I listed here, as a silent autoimmunity, where we don't have symptoms, but we've got antibodies. Then it progresses to autoimmune reactivity, where there's some loss, we notice something's going on, occasional signs and symptoms, and then later it progresses to full-blown diagnosed autoimmune disease, where there's loss of function and major signs or symptoms. You want to try to catch these things early, because all autoimmune disorders are actually becoming epidemic according to some researchers and some authorities. Diagnosed by brain MRI and symptoms only, this is MS again, characterized by a destruction of the nerve myelin sheath. That's a little white coating around all of our nerves that helps conduct our nerve signals. Brain lesions are oftentimes due to antibodies, though, produced from, believe it or not, a gut problem in many cases. So this is an interesting test that can be run if you go to cyrexlabs.com. Their array number 7 actually is something that you can ask your doctor to test for brain antibodies. So early recognition signs of any form of dementia or brain degeneration, the first thing is poor short-term memory. And this is a problem in the temporal lobe in the brain. Later on, you'll see things like, and not necessarily all of these, some people have a few, some people have a bunch, mouth is always open, there's a lack of facial expression, there's less blinking. They'll just stare out at the wall for the longest period of time without blinking. Low motivation, can't multitask, they've got bad social skills, they might blurt out bad language in inappropriate social situations. There's increased irritability, like you have to walk on eggshells around them, they say. A lot of procrastination, there's more depression, they might be a slow tremor or slow movements, sometimes an eyelid drop in through there, they call it ptosis. Poor body balance. People oftentimes have a decreased arm swing, so when they're walking, their arms are just kind of drifting at their sides without really swinging normally. And then also long-term problems. These are all what we consider frontal lobe brain issues. So the earliest sign of Alzheimer's, though, is depression and apathy. The early warning signs of dementia and Alzheimer's in general, though, is memory loss that disrupts daily life. Again, we talked about challenges in planning and solving problems, difficulty completing basic tasks at home and work, and confusion, trouble understanding visual images, new words and speaking and writing. They misplace things constantly, like where did you leave your keys, where did your glasses go? They can't retrace their footsteps really well. Decreased poor judgment, withdrawal and work from social activities, and change in mood and personalities. And note, the earliest sign of Alzheimer's disease is depression and apathy, though. Decreased blinking is another sign, too, of early brain degeneration. So later stage symptoms of any form of dementia and Alzheimer's can include, not all of these again necessarily, but it might be several or more, inability to communicate, inability to recognize people, places, or objects, they're not walking or not smiling, facial extremity muscle contractions, like they're contracted all the time and tight and tense, inability to swallow, they might have seizures, weight loss due to lack of eating or inability to eat, they might just be sleeping all the time or constantly snacking. And Alzheimer's disease, if you really want to get into it, is characterized by something called an amyloid plaque. So it's a bunch of junk that builds up in the brain. Something called tau proteins create what they call neurofibrillary tangles, and it looks like a bunch of bird's nest stuff inside the brain. And what happens is then our immune system cells in the brain have a hard time taking out waste products, or what we call can't take out the trash. Also, there's a decreased level of acetylcholine. That's one of our brain little messenger molecules responsible for short-term or quick memory. Medical treatment is typically something called acetylcholinesterase inhibitors. There's memantine, which is also called Avandia. There's others like Aricept, etc. Many, though, have some confirmed side effects like increased heart rate, fractures, and things like that. Some studies even say that they're no better than placebo. There's a mild cognitive impairment, which is also sometimes a prelude or a precursor for Alzheimer's. David Perlmutter, who's a pretty well-known best-selling neurologist, says the highest Alzheimer's disease risk is actually foods, especially gluten and excessive levels of sugar and refined carbohydrates. So what stage are you in, and how fast is it going? What are you doing about it? What about your family and friends? I just got to impress upon you the importance of these are things that you want to get on early. Don't wait for brain degeneration and these symptoms to set in if you can, because once they're set in, it's really difficult to turn the ship around. This is why in conventional medicine there's very few treatments that can stabilize this stuff. So an interesting thing with a couple of studies, there's a growing public health concern again with this stuff because of lack of effective curative treatments. So if we look down below, though, it says in this last sentence on the upper paragraph, says current data is in favor of a protective role of certain micronutrients in the prevention of cognitive decline and dementia and Alzheimer's disease. So this is where we're getting into diet and supplementation. The second paragraph down below says no curative treatment is available, but research provides a substantial amount of evidence of a modifiable risk and protective factors to prevent or delay the onset of Alzheimer's and dementia. And again, here we're getting into natural, non-toxic therapeutic strategies. Parkinson's, again, another form of dementia. That's a deficiency or a dysfunction of what we call the dopamine-producing cells located in part of our brain. And that's a neurotransmitter that's responsible for pleasure, pain, and reward. The standard of care for medical treatment for this stuff is something called carbidopa or levodopa. This is called Sinemet or Parcopa. There's Mirapex. There's other drugs in through there. And if you take it and you notice there's decreased signs or symptoms, it pretty much confirms the process going on in through there. There are potential side effects and resistance that can happen over time for some people. Just talk to your doctor about that. A side note, there are many good papers and research studies on what's called ubiquinol, which is the reduced form of coenzyme Q10. It's a nutrient found in every cell of the body. Highest concentrations are in the gums and in the heart. Very non-toxic under any amount, and you just take a lot of it. And some people say, well, how much should I take? And so we basically say, you know, take as much as you can afford because it's actually really good for you, and there's been some really good papers published on that. I know in a lot of our patients, when we're working collaboratively with other physicians and brain issues in through there, we put people on CoQ10 and they notice really good symptomatic results. And then there's also something called glutathione, which is the body's best naturally produced antioxidant. So early age of Parkinson's, you know, at age 26 or less makes a very, very small percentage of the population. Most of it is people, 90% is 60 or over. Early warning symptoms are lack of smell. Number one is loss of smell. It often leads to a decreased appetite. Can be constipation, but constipation can become from a lot of stuff. But constipation is one of the symptoms. It happens about 20 years before the onset typically. Slow movement, again, we talked about loss of arm swinging when you're walking, depression, postural instability like they stumble or flex forward. This is what we call a shuffling gait. Fatigue, problem sleeping, restless leg. There's also something called micrographia, which means small handwriting. And more than one of these signs doesn't conclude that you do have Parkinson's or Parkinsonism or Parkinson-like syndromes. It just means that it raises a suspicion for some of these processes going on, that's all. So progressed sign or more advanced signs of Parkinson's, now you have less dexterity and coordination, there's writing cramps, there's slurring of the words, and a postural instability. When they're walking, there's always a big risk of falling. And this is one of the things when there's advanced Parkinson's, one of the biggest risks of falling forward and landing on your face, and you can fracture the face bones and even die. Same thing with advanced Parkinson's. Again, below, there's that resting tremor. If you see someone with a resting tremor in their arm or hand, that's oftentimes pretty progressed. 80% of those dopamine-producing cells in the brain are already gone by the time that someone has a resting tremor. There's also rigidity, there's dementia, and there's a very expressionless face that is oftentimes characteristic of this. So the top 5 tests for early Parkinson's that are very easily done without doing blood tests and laboratory analysis and brain scans, which any neurologist and physician can run. But the first thing is difficulty identification of smells. So we oftentimes will use coffee or peppermint or peanut butter. We have a little smell test that we sometimes do in the office. Also dual tasking. We have people walk sometimes in the hallway when they're trying to say the alphabet or every other word in the alphabet, or saying odd numbers. If they're walking and we say, I want you to say odd numbers like 1, 3, 5, 7, 9, 11, but they have a hard time doing that when they're walking, or they stutter step, or they have to pause a little bit, whether it's alphabet or numbers, that's not a good sign. Finger tapping, where we have people kind of spread their thumb and index, and then they clip them together as fast as they can, like they're tapping the thumb and the first finger together as quick as you can. You want to see a nice, even, symmetrical thing with that. If you don't, well, there could be other things you want to get that checked out. There's what's called a pull test, when you actually come up behind somebody and we stabilize them and we just give them a little tiny tug on both of the shoulders as they're behind them. And if they kind of stumble around a little bit, we always tell people, hey, look, we're right behind you. You're not going to fall. We just give them a little quick nudge on both shoulders like we're pulling them backward. And if they take a couple of steps backwards suddenly, that's normal. But if they are going to fall, or if they take 5 or 10 steps or more backwards and they're really unstable, that's a possible sign of that as well. And then there's also called the stand-up test. This is what we call the stand-up and go test, where people have a hard time getting out of a chair. Now again, this can be from low back pain. It can be from the chair is in a deep bucket seat, or you're sitting in a beanbag. But in general, the stand-up and go test is also another thing that we look for. It's very hard to get up out of a chair. They might try 3 or 4 times, and then they finally get going. So again, there's no cure for advanced brain degeneration, but we can recognize the earlier signs, slow the onset, reduce the severity, and you can kind of increase the working function of what you've got. It's almost like an adaptation that can happen. So developing a healthy lifestyle, diet, and targeted nutrition can all support various aspects of the brain. The brain destroyers can include low blood flow, reduced oxygen, whether there's sleep apnea or cardiovascular disease or a variety of other things can do that, shallow chest breathing when there's stress, blood sugar imbalances, and any forms of inflammation. So do you have enough oxygen? One of the things that we do in the clinic is called a capillary refill test. You just squeeze the tip of the finger really quickly until it blanches, and then you want to look for that color and the blood to kind of come back pretty quickly. It should take about a second or so or less. If it doesn't, then there may be poor, what we call capillary refill. The blood isn't getting into those distal extremities like the hands. Same thing with the feet. The feet, typically we'll see people with multiple toenail funguses. Now, granted, this can be from people that are in the water all the time, or they have fungal spores in their shoes and they never change their socks, and a variety of things. And there's a variety of treatments for this. You can check with your podiatrist or your orthopedist, or any other family physician sometimes can look at these things. And there's laser treatments. There's nail fungus treatments called Sporanox and whatnot. And there's actually a number of non-toxic and natural things like essential oils of tea tree oil, or carvacrol, which is also the essential active pigment in oregano, limonene, which is a double distilled extract of orange and citrus. But a lot of these, even foot soaks with peroxide. But a lot of the times, if there's multiple nails and or people have tried these things and they come back, oftentimes it means that there's a lack of adequate tissue or blood perfusion, a weak blood flow to those distal parts. And oftentimes, if you got a poor capillary refill and you got nail fungus all across the board, it can oftentimes mean that there's not as much good blood flow into the brain as well. It's an easy thing to check for tissue perfusion. In fact, in the clinic, we'll oftentimes use a nitric oxide test. So the brainstem, the part of the brain where the spinal cord meets the brain in through there, that's a very sensitive area for issues with the brain as well. And if those areas are impacted by a lot of these factors that we've talked about, people will get things like constipation, they got chronically dry eyes, they can have reduced spitting and reduced saliva, difficulty swallowing pills, they're constantly bloated after meals, maybe their heart is fluttering and racing, their cold hands and feet are there again because they're not getting that blood supply in. They might have bowel or bladder incontinence, high blood pressure, or a right and left blood pressure difference with different arms. This is something that most clinicians can check in their office. These are some of the things to kind of get you thinking anyway that, hey, there could be a problem with the brainstem. So stress and its impact with the brain. Well, we have emotional stress on the far left in there. There's toxic stresses like chemicals and heavy metals and infections. There's physical stress like trauma or overtraining for marathon. All these things activate a stress response in the brain, and those can potentially create increased inflammation and fatigue and bone loss, breakdown, intestinal damage, and poor immunity and bad memory and focus and whatnot like that. So one of the things we talk about is we really want to get good sleep. A good sleep is vital for brain function for a lot of reasons in through there, and it's a little bit past the scope of this small presentation to get into that. But cortisol is a stress hormone, and often we need to have some cortisol. But if the cortisol is too low in the morning, it oftentimes, is seen by we can't get out of bed, have a hard time getting out of bed, assuming that we've slept properly. If it's too high in the morning, that means we're too catabolic, we're breaking things down and we need more rest. If it's too high, oftentimes late at night, those are some of the issues where we find that people have a hard time falling asleep. We test cortisol levels by using a multiple sample 4 times hormone panel using saliva. Now, saliva is a little bit more practical than a blood because you can monitor it several times. It's hard to check, just a one-time blood sample and get a really good indicative overall assessment of your cortisol level, because our hormones do fluctuate from day to day, and most people aren't going to go into a phlebotomy lab and have their blood drawn 4 times in one day. So saliva is a little bit more accurate, and it picks up what we call the biological or the free fraction of the hormone. But know this, that altered cortisol level is now officially recognized as one of the measurements of Alzheimer's disease progression. So we say here on the right, elevated cortisol that's constant and chronic sometimes is more found in the apple-shaped body, where people that hold a lot of fat around their waist, as opposed to the pear-shaped body. And why is this important? Well, because chronically high cortisol, and this happens not just in people with that type of body type, but chronically high cortisol leads to systemic inflammation, especially in the brain. So one of the things that we have for this, we do diet, we do lifestyle interventions, we do stress reduction, and one of our favorite products is something called Cortisol Calm, which we'll talk about at the end. So guess what? No drug can actually slow a brain degenerative process, and brain inflammation and function can be improved in many cases by addressing the underlying mechanisms. And so here we get into the intestines and the gut and how that relates, and know that all digestive systems signaling starts in the brainstem, because that's what drives our gut function. You need a healthy brain activation to digest food. And so one of the things we'll find is people have low stomach acid, also called hypochlorhydria. Now, most people are afraid, or they think that they have too much stomach acid, and many times that's not the case. It's actually a deficiency of stomach acid, and what causes this things many times is lack of adequate alkaline foods like fruits and vegetables, certain prescription medicines, chronic stress and infections, toxin exposure, allergies, chronic inflammation, sometimes just bad eating habits, just eating way too much and way too late, or eating way too many processed foods. So common symptoms of this low stomach acid or bad digestion can be belching and bloating after meals, or fullness, GERD, which is reflux, nausea after taking supplements or heavy proteins like meats or eggs, diarrhea, constipation, lots of bowel gas, chronic yeast and candida infections, undigested food, chunks in the stool. Corn is normal because those have a lot of cellulose around them, and we're not cows. We don't have those cellulase enzymes like they do as much, but oftentimes people see I got a bunch of lettuce or there's some meat fibers or something chronically there. Once or twice, no big deal here and there, but if it's a chronic problem, then that can lead to suspicion that you might not make enough stomach acids up above. And then rectal itching. Rectal itching can also be a hemorrhoid. Hey, it can be parasites, there can be other things, but it is one of the things that we say that may be indicative that you're not making enough stomach acids. And so here's when we look at posture. When people have a slumpy posture, sometimes that's from mechanical stuff, right? And just learned muscle problems. We get people on core exercises and, change their mechanics, maybe their workstation, things like that. But a lot of times, believe it or not, this slumpy kind of a posture, and here's a characteristic person that has that, is sometimes due to low hydrochloric acid output. It's called a hypovagal posture. Sometimes there's a center in the crack in the tongue, There's coating in the tongue that can be there too. In Ayurvedic and traditional Chinese medicine, they talk about this as a lot of the digestive problems. And there's also ridged and brittle nails. These little ridges marks that we see up and through there can oftentimes be that too. 1 or 2 nails, no big deal. But if it's on all of them, that's one of the symptoms. So this is important because it ties in with something called a leaky gut. Leaky gut means you have an intestinal barrier compromise. This is microscopic usually, and there's a couple of things that has to happen. We have to have a deficiency of our body's best natural antioxidant called glutathione, and we got to have inflammation. Why is this important? Well, leaky gut is a main trigger of autoimmunity, but also brain inflammation. Here's a study that talks about that. So alterations in healthy gut flora, which is our bacteria and leaky gut, can be caused by excessive alcohol or drugs or antacids, chronic infections and stress, food allergies, obesity, toxins and heavy metals, bad sleep, electromagnetic field and radio frequency fields that we're constantly exposed to. And here's a test that we oftentimes will run in our clinic, although we don't run lab tests on everybody, obviously. Some people can't afford it. Some of their insurance doesn't cover it. But, you know, this is a really nice test if you want to look this up more. It's called Cyrex Labs. Their array or their panel number 2. And it's looking for antibodies that are made against parts of the cells in your gut that should never be in the bloodstream. So if some of those cells are kind of breaking down, they're releasing some of those protein molecules and substituents in the cells that should always be tightly wrapped up in the cell. If the cell's starting to get destroyed a little bit and there's compromise in through there, it releases some of these little proteins and the body doesn't recognize that and it makes antibodies against it. So that's the gold standard. So leaky gut, why is that a problem? Well, the proteins get into the breach through the intestinal barrier, they get into the inflammation, they trigger the immune system. Gluten is oftentimes a big problem with this, especially celiacs, but a lot of people think that just because they don't have celiac that they have no gluten sensitivity. That gluten sensitivity is sometimes the milder stage of these things in through there, but it basically creates what we call a leaky blood-brain barrier as well. And a leaky gut equals a leaky brain, and that creates brain inflammation. So the barrier in the brain is a selective network of blood vessels that's supposed to keep out big molecules in through there, and it only selectively lets some come in. If other ones come in, then it starts triggering an immune response in the brain, and that's another trigger for creating brain inflammation. So basically a gut on fire means that a brain is on fire. And this doesn't mean that, oh, I ate too much chili or some salsa. This is like a constant chronic problem with digestive stuff and or testing on these methods that show you have a leaky gut. When those happens, typically that also means that there's intestinal permeability problems. And when the brain is, quote, on fire or inflamed, we can't feel that. So this is what contributes to brain inflammation: bad fats, heavy metals, excessive sugar, infection problems, sometimes a lot of toxins, a lot of alcohol. Some people say that there's some genetically modified foods that can trigger that. There's no long-term studies for that, and I think that's partly due to the fact that there hasn't been a lot of funding for that. Clinically in my practice, we do see that genetically modified foods are not a good thing for people's brain. We like to get close to Mother Nature as possible, which means nothing that's been done in a laboratory by our foods. So depression can also be contributed to some small amount with leaky gut. Again, inflammation in the brain stimulates the immune system. It lowers our body's chemical messengers, these little happy hormones that we have, so we have problems there. The main non-gastrointestinal or non-gut symptoms of leaky gut, though, include depression, chronic pain, and fatigue. Now notice that there is some studies to show that really after really bad head traumas and concussions, you can get temporary leaky gut too. So it's not just from dietary stuff, but depression, pain, and fatigue are oftentimes symptoms of a leaky gut as well. So here we talk about bread, gluten basically. Gluten is not our friend. And David Perlmutter talks about this a lot. And interesting enough, though, most gluten reactions occur in the brain, not in the gut. And that didn't show out really well in there, but that's from a neurology journal in 2003. This is David Perlmutter on the bottom left, and that's his book called Grain Brain on the right. He's a famous neurologist who's got a number of best-selling books out. There's Datis Kharrazian's book called Why Isn't My Brain Working? These are all really seminal works in terms of brain function and very non-toxic, natural things that we can do. So we talk about blood sugar and insulin. These are things that happen with problems with a lot of people. So one of the things we have people do is get off flour products. It spikes blood sugar, it spikes insulin. These all create inflammation. Sometimes people need to go off grains or at least reduce grains and sweets. We have them bump up their protein in vegetables. These are things that are really, really easily outlined in my ebook that you can get on Amazon or iTunes or Google Play called The Foundation or Cell Vitality Diets. And then we also want to heal our cell membranes. This is where we happen with cellular detoxification, real cell detoxification, and healthy fats. And then we also talk about targeted natural anti-inflammatories. Turmeric and resveratrol are big ones. So notice here, though, according to this one medical journal, the part of the brain responsible for memory, the hippocampus, is extremely sensitive to damage by high blood sugar levels, which can result in dementia. This is why one of the reasons they call dementia or Alzheimer's disease type 3 diabetes. It's an interesting term being coined now. Here's my ebook available. It's again on Amazon, Google Play, iTunes. It's called Supercharge Your Cell Vitality. It's only 60 pages. You can read it cover to cover in one night. It's a bottom line synopsis of the salient, timeless principles of health and nutrition. And there's some diet guidelines in there. There's some recipes. There's some menu options. But it talks about a lot of those things in there, along with a number of medical references as well. Really great article by Jennifer Ackerman and Scientific American called Your Inner Ecosystem. Tells about how the gut is really important with our general overall health and how our bacterial cells outnumber our human cells 10 to 1. So we want to treat our gut bacteria and our friends really well. So some corrective strategies for leaky gut and leaky brain is that you want to test for these things. You also want to test for possible gut pathogens, and this is, stool testing or whatnot. We oftentimes use something called a GI pathogen purge kit, which can also be found on our website as well. We test for food intolerances. Sometimes there can be an elimination diet or a hypoallergenic diet that you can do. We oftentimes will recommend the Foundation or Cell Vitality diets as listed in my book. We restore digestive enzymes and bacterial imbalance. Sometimes that's just called eating more fermented and cultured foods. I have 2 pages in my book about that, whether it's yogurt or kimchi or sauerkraut or borscht or a variety. Miso is a really big one. Some people like probiotics. Probiotic supplements and through there are a really big thing. And there's also a gut repair program. We have something called the GI Wellness Kit that works really, really well for a lot of people. Now, I have a note here at the bottom, blood homocysteine, which can be done by any clinician, any physician's licensed to diagnose of any type, chiropractor, a naturopath, an acupuncturist, a medical doctor, an osteopath, a podiatrist. They can all run these tests, and it's called blood homocysteine. And if you can't find it, if your doc won't run it, just go to directlabs.com and do it yourself. You don't want a value higher than 10. The reference ranges are typically higher than that, but you want it lower than 10. Why? Because homocysteine, which is a byproduct of insufficient type of amino acid metabolism, happens when we're a little bit low in folic acid and B12 and some of these what are called methyl groups. This thing, when it elevates in the blood, is a contributor for cardiovascular disease because it makes our blood fat sticky. It creates what's called endothelial damage. But the bigger thing is it creates the blood-brain barrier breakdown and inflammation in the brain. So you want to make sure you get this thing tested. Brain neurochemistry, well, these are our messenger molecules of mood. There's serotonin, there's dopamine, there's acetylcholine, and there's GABA. But again, the bottom line here I want to point out is not to get too detailed, but these are strongly influenced by our beneficial gut bacteria and also our nutrition status, our sleep, our stress, our oxygen levels, and our sugar balance. So dopamine and serotonin, again, here's a couple of other things. If we have really low serotonin, we're usually depressed. We crave carbohydrates and sweets. We don't digest the food really well. If dopamine is really low, this is people that have an increased ability to handle stress. They're depressed. They're not motivated. They can't finish projects. They start a lot of stuff, but they never finish anything. They've got really low self-esteem, etc. They have a lack of sense of smell if that really gets progressed. So here's something I want you to look at in here. This is a really nice test. I want you to look at this slide. You're going to have a minute to look and remember the images on the next slide. So check out everything you can here. Take in all the shapes and colors, the amounts of things, anything that you see if someone's going to give you a detailed question later. Okay, that's a little less than a minute, but for the sake of brevity for this presentation, I'm going to move on a little bit. So now I'm also going to give you 10 words in here. This is basically a verbal memory test. So how many of the following words can you remember? There's going to be 10 words, okay? So remember these. Don't write them down and don't cheat. Car, mountain, pen, apple, horse, sunflower, salmon, computer, umbrella, and dryer. So car, mountain, pen, apple, horse, sunflower, salmon, computer, umbrella, and dryer. Remember those. So going back to the visual, how many buildings were in that other image that we just showed earlier? How many cars were in there? What was the color of the empty pickup truck? And what was the color of the bus? If you got less than 50% of these things right, this is a significant concern for memory health. So there we go. There's the answer. You can always go back and review this later. So the verbal memory test, how many of those words can you remember? So here's the answers. The car, the mountain, the pen, the apple, the horse, the sunflower, salmon, computer, umbrella, and dryer. Same thing, 5 or fewer or less than half, half or less, that's another concern for memory health. So note that poor verbal and image memory are the earliest signs of dementia. So how did you do? So let's talk about brain nutrition. So one of our favorite anti-inflammatories is good old-fashioned turmeric. The active constituent, curcumin specifically, also resveratrol, which can be found in red grapes and some peanuts and some red wine. Although we want to be careful about red wine, that was given a lot of press, but it really doesn't have that much in through there. Green tea, ginger, and polyphenolic compounds. These are active bioflavonoids and related antioxidants found in a lot of purple and red fruits and vegetables. What we oftentimes recommend is something called ROX. We use a dose of 1 or 2 capsules twice per day with food. Some people, their testing might reveal a higher need. But notice that here's a couple of journals that talk about that curcumin, again, this is turmeric, crosses the blood-brain barrier and binds directly to plaque. And animal and human studies show that curcumin can actually stimulate the white blood cells to absorb and possibly start digesting the plaque. Interesting. So the data suggests that curcumin-based compounds have powerful antioxidant activity. They can reduce brain inflammation and potentially neurodegenerative diseases, including Alzheimer's. Wow, to me that's fascinating. So accumulative evidence, again, from a couple of journals here, this one specifically, Neurochemical Research, shows that accumulated evidence that naturally occurring phytocompounds, such as these things found in fruits and vegetables, herbs and spices and nuts, may potentially hinder neurodegeneration and improve memory and cognitive function. Now, if people have pretty significant advanced brain degeneration, doesn't mean that eating some spices and some vegetables is going to totally turn the ship around, but it's definitely helpful. So the question for you again, is your brain on fire? Well, you don't know because you don't feel it, but some of these symptoms are there. So here's what we do in the office. We use some of these little urine tests. These are also things that can be done at home. It's actually more accurate than blood testing. It measures something called malondialdehyde, which is a lipid peroxide, which is an essential or an unsaturated fatty acid that's found in all of the membranes of our cells, and we don't want it to turn a color. If it does, it means that there's oxidative damage or oxidative stress from free radicals, and that means inflammation. So nutrition for a brain on fire. As we start on the left, eggs. If you tolerate eggs, we like them kind of cooked, kind of runny if you can, boiled or soft-boiled or poached, over easy. You get all those beneficial phospholipids and essential fats found in the yolk. If you're scrambling them, you get the protein, but you oxidize the cholesterol molecules in there. It's called oxysterol, and that's not as healthy for you. Also moving up, you see some fermented foods. This is a thing of yogurt, but you can also use kefir. You can use coconut yogurts if you're intolerant to dairy, or there's sauerkraut or kimchi. There's a variety of other things in through there. I like to have people go to culturesforhealth.com. There's some really good articles and stuff in through there and some nice websites. In my book, Supercharge Your Cell Vitality, I have 2 whole pages specifically just on fermented foods. And then we talk about our good old friend turmeric again. Turmeric is in the ginger family, and ginger will do it as well, but turmeric is one of our favorites. Best if you're taking it with fat, and you have to take a therapeutic amount. You just can't get a turmeric shaker and sprinkle it on some rice or sprinkle it on some vegetables once in a while and expect much out of it. You got to get a therapeutic dose. Healthy fats are important too. Monounsaturates found in like olives, avocados, raw nuts and seeds, even roasted nuts and seeds, but especially raw. The omega-3s, especially DHA, docosahexaenoic acid, one of the omega-3 fats found in fish, is just absolutely wonderful. There's a vegetarian version of that as well that they get from microalgae. Fruits and vegetables, again, why? Well, because of all the antioxidants. It kind of reduces that oxidative stress. Here's some compounds and some really targeted, exceptionally high-quality nutrients that we use in my clinic a lot for this stuff. Resveratrol extra, curcumazorb, which is a high-potency, easily absorbed, about 4 to 5 times better absorbed form of curcumin than just taking it out of a shaker or shaving the root off. Spectra 1, that's the only 100% food and organic-based multivitamin right now. We just have people take 1 a day sometimes. There's something called MORS. This works for methylation pathways, which if your homocysteine in your blood is high, causing your fats to get sticky and your brain to get inflamed, it's a nice product to take for that. We have L-Gut, which is a problem specific, or a product that we say specific for if someone has leaky gut problems. We have G-Cell, again, for leaky gut. It also helps our oxidative stress problems in the body if you test high. Vitamin D3, there's some really interesting research on vitamin D3 right now with diabetes, believe it or not, which is a big thing that causes brain degeneration. In fact, in the journal Nephrology of June of 2014, it showed that if your vitamin D level is low in your blood, you can have a pre-diabetes risk. But dementia, the journal Neurology of August of 2014, just this year, showed that seniors that have low vitamin D have double the risk of Alzheimer's disease and dementia. Interestingly enough, depression too. The journal Neurology of July of this year of 2014 showed that depression was significantly increased when the D is low. So vitamin D is a really big friend, and you want to supplement with that typically in the wintertime. Talk with your practitioner. You want to get your blood level baseline established. Just don't go out and take it willy-nilly. Cortisol Calm, this is a product that we like. It's a combination of synergistic herbs. If people's cortisol level is too high, you got to bring cortisol down because it can create brain inflammation. MetaboShake is our favorite if the blood sugar level is too high. It's one of our favorite things for kind of helping to orchestrate with people, with their clinicians, about getting blood sugar levels under control. And I did put a note, clearance of food sensitivities and pathogens are oftentimes critical for success. We oftentimes will recommend something called the GI Pathogen Purge Kit. Follow that up later on by what's called the GI Wellness Program that really kind of covers a lot of ground for general health and maintenance and fostering wellness in the body, as well as specifically relating to the brain. So what's the bottom line? Well, brain degeneration is inevitable, but you can slow the process, live a long and healthy life with full brain function, but the key is acting now. Don't wait for things to happen. Effective strategies can be eliminating toxic sources and exposures. You can go to environmentalworkinggroup.org. Toxic Beauty by Dr. Sam Epstein is a great book that talks about personal care products and other things that are toxic filled in our environment, our lifestyle. Start an anti-inflammatory diet. Like, we really love the Foundation, or especially the Cell Vitality Diet in my ebook. Reduce electromagnetic field and radio frequency fields. Do some earthing, which is putting your bare feet on the ground, on natural ground. And you go to earthing.com to read more about that. There's other couple of websites that talk about the electromagnetic field stuff. That's a whole subject in and of itself. Try to reduce your stress by these various things. Get quality sleep. Try to exercise more. Minimum of 3 to 4 times a week. Cardiovascular stuff is good, but what the research is really starting to point a finger to on is something called burst or high intensity interval training. The reason why is because it increases something called BDNF. And what BDNF is, stands for brain-derived neuron factor, and that lets our neurons branch out and make all these little extra shoots that come off of it that help increase the function of our nervous system. So we also recommend almost everybody start a targeted nutritional supplement program. And these are some of the ones that we recommend, like resveratrol extra. There's the cortisol calm and the G-cell and the L-gut, Moore's, little vitamin D, curcuma sorb, some of these packages. Not everybody gets everything, but a lot of times with chronic brain and neurological stuff, you really need to support the body on a lot of areas and through there. And so we also say that's why we say start a brain health and vitality program. So bottom line, these nutritional support products may be ordered directly from our website. That's healthquest4me.com. Just simply click on the product section on the main page. And here's just a classic example of what we do in our clinic for the HealthQuest Brain Health and Vitality programs. We do a complete history. We have people fill out what's called a BFAF, which is a brain function and assessment form. We do a true comprehensive functional brain and neurological examination. It takes about 15 to 20 minutes to do that, far more than what your average doctor is doing. We do a complete metabolic exam, which include vitals. We do pulse oximetry. We run an energetic stress test, or sometimes muscle testing. We'll do a tongue and abdominal evaluation, abdominal palpation, kind of similar to what they do in traditional Chinese and Ayurvedic medicine, but also from a conventional Western medical perspective. We run a body composition test called a BIA test. We run heart rate variability, which is a kind of a measurement of overall nervous system vitality. Many times we'll run what's called a visual contrast sensitivity test, which is an indirect marker test for picking up hypoxia in the brain, especially in the optic nerve, especially if you've got toxins or infection in the brain. Sometimes urine tests and lab tests we'll do as extra as well. We do personalized diet and nutrition, obviously. Lifestyle, we do brain rehabilitative exercises. Some of our advanced therapies include whole body vibration therapy, which is the WBV. We'll oftentimes use pulsed electromagnetic fields, or PEMF. That helps the wellness and vitality of the cells as well as the circulation. Oftentimes we'll suggest EWOT, stands for exercise with oxygen therapy. People can do that on their own. And we also have light therapy. We use a technique and a technology called Light MD therapy. It's a very sophisticated light therapy system that has a very beneficial effect on the body in a lot of ways. It reduces pain and inflammation and things like that, speeds healing. We oftentimes do monthly follow-ups. We have 6 and 12-month programs. If you guys got any questions or comments, you can always call us or send us an email. So bottom line, though, is I hope you've understood that the brain really is our ultimate treasure. Really treat it right. It's something that's largely swept under the rug in the conventional healthcare system. Now you know what some of those signs and symptoms are of early brain degeneration. Work with a clinician or a practitioner to kind of do some of these tests and through there. It really is important. Again, prevention is always better than active treatment. I hope you guys have enjoyed this. Have a great night. I wish you all the best of health.